Dr. Meyer, thank you so much for joining me today for this interview on your presentation for the 2011 Annual Conference, Ethical Issues in Clinical Practice. Thank you so much.
You're welcome.
So I have some questions for you. This is a wonderful recording and so much valuable information in it. How did you become so interested in ethical issues in clinical practice?
Well, I've always been involved in boards and politics, and ethics have always been an issue as I worked on licensures and even local community boards, making sure that everything was had boundaries. Everyone had boundaries, and there were things in place that protected each party that might be presented.
Yeah, and these issues are so important to our field and to upholding those standards that make us a profession that is trustworthy and accountable.
Absolutely, and there are so few people who really understand the issues until they're presented to them.
Yeah, for some folks it's a topic that's constantly on their mind, and it seems like for others it's something they only think of when all of a sudden they've realized they've encountered a situation where perhaps they should have been a little more prepared in advance.
Exactly, and those issues change as new technology comes into place or lifestyles change. So we always have to be on top of, how do we fit in? How does our work fit into ethics and protecting the public or protecting ourselves?
What do you see as some of those up-and-coming issues right now that perhaps were not on clinicians' minds or on the mind of our field even just a few years ago?
Well, I think clearly people are more transient than they ever were. The crossing state boundaries or even international work creates the complexity of who's really practicing where. We never had Skype before, and now we have the international consultations that occur. And so who's really in charge of the work that's being done?
Important questions, absolutely. And in some ways I see some conversation happening across mental health professions that it's almost some sort of free-for-all in this new world of, especially when it comes to social media, and you mentioned Skype, but we have these guidelines in place that still apply, and we're continuing to develop those as well, correct?
Correct.
Very good. So for this presentation that you gave for us in 2011, along with your co-presenters, you walked people through the actual deliberation that happens on an ethics complaint. What is that? Can you sum that up for us just a little bit for folks who are interested in it and I've never heard of how the process works before?
Well, people actually don't understand, how the process occurs. And what I've been hearing is that they assume that if there's an ethics issue, they're reported and that's it. They start to panic. What I think is really important is that the person who is charged is also a part of the process, and everyone has a place to give input and defend and speak to the issues, particularly those who cross lines with different professions. For instance, if someone's a social worker and they're also an MFT and they're in a position in an agency and being called on, it's a tough call for the employee to be able to stand up for themselves, and they really need to be clear on what they're able to do and be able to speak to that. I think we as a profession are changing that way. We have to look at what we're really asking our clinicians to do as we move into different arenas.
Thinking about this workshop from this past year's conference, what do you most hope that members will gain from this presentation as they listen to it online?
That there are many people asking similar questions, that it is not black and white, dry. There is always room for discussion, and it's like any legal entity. Lawyers are there to present a case and to defend a position, and as something gets defended, it changes the way we look at it. So I think they will get insight by listening not only to what we presented, but to the audience's responses and questions. So I think they're very, very valuable tools.
Is there a particular part of this presentation, or perhaps one of the audience questions, that really stood out in your mind as a favorite part of this presentation for you?
Well, I love to know what's going on in the field from different perspectives. So for me, it was really valuable to hear what they were asking. So we, as a committee, could take a look at the needs. It's very different to be sitting in an office by yourself or sitting in AMFT or any other professional structure and deciding what should be. But when you hear it from those who are actually doing the practical work, it sometimes has a whole different flavor.
Thank you so much for bringing this knowledge to the association, to our membership with your fellow presenters, and also for taking the time to speak with us today.
Well, my pleasure.